In this video, what we are aiming to achieve is to explain to people who are coming in from abroad, both from the European Economic Area and from outside, on how to adapt to working practices in the UK. As a new radiologist coming into the department, you may be either a consultant radiologist or coming in as a clinical fellow into a department. So depending on your level of expertise and your competencies, there will be certain expectations.
I'm Dr. Harvey, I'm the consultant radiologist. I'll be doing the examination this morning. Jackie's
You'll be expected to treat your patients with dignity at all times.
Step up onto our table here.
One is expected to explain the procedure clearly to them in simple language so that they understand what they're giving consent for.
What I'd like you to do is take a nice generous sized mouthful, hold it in your mouth, and then we'll take the cup away when I say swallow.
And in many procedures, there is informed consent required before the procedure is performed.
The throat down to the stomach. All right.
The other expectation is mainly from the colleagues within the department will be that you treat them courteously at all times, that you respond to their queries politely, and you are available to help them. You are expected to be always acting within your competencies. So usually people are expected to give advice on areas they're competent in and not in areas they have not had much experience in. One of the exciting things about being a radiologist is the interactions that you have with a multitude of clinicians from various specialties. On a weekly basis, many subspecialties will have a clinical radiology meeting and often a tumor board meeting, otherwise called a multidisciplinary team meeting, where cases are discussed for getting summated opinion from a range of experts. A radiologist is expected to review the images available for the patient and then present the key findings at these meetings so that the team is able to take an informed decision on treatment and further management of these patients. Increasingly, many hospitals offer direct access to GPs, otherwise called general practitioners. So they are able to request MRI scans, CT scans, ultrasound scans, plain films, and often minor interventional procedures such as ultrasound-guided biopsies. Often, general practitioners will ring the duty radiologist to inquire about a report or to clarify a certain report. Therefore, when phrasing a report for a general practitioner, it is important to be clear and simple in the use of phrases. The other reason to be concise and clear in your reports, especially for general practitioners, is the fact that general practitioners are expected to cover a wide range of specialties and they are expected to act on the reports that you provide. And sometimes it makes sense to advise the general practitioner to take a certain management step, such as refer to an orthopedic surgeon or a neurologist for further investigations or management. Communication is the key to success within the NHS. Therefore, it is important that one is polite and one is clear in our delivery of speech and also in the written communication regarding emails. It's important to know the names of the radiographers that you may be working with, the radiologists that you're interacting with, the clinicians you're working with. Addressing someone by name may not be part of the culture of many other countries such as in India or Pakistan. But in the UK, one is expected to refer to people by their surname, such as Mr. Smith, Mr. Jones, Mrs. Jones, etc. Uniform, they are bizarre shaped. When you're talking to people face to face, you must try and make eye contact so that you're seen as polite and approachable. Looking away from people is often seen as being disrespectful. And try to speak slowly rather than rapidly. Occasionally, your accent may be slightly foreign sounding to the people listening, and that's another reason to have a slightly less rapid speech, which I often find helpful for my own practice. Yes, I realized that she's had breast cancer in 2007. It is important to understand certain etiquettes while conversing over the telephone. It is always useful to identify yourself when you pick up the phone to receive a call or when you're making a telephone call to another person.
Yes, Dr.
It's also important to clarify who the other person is at the end of the line, because this can often avoid misunderstandings. Did she have any history of a fall or any trauma? In certain cultures, for example, from the north of India, I often observed that people often put the phone down without concluding a conversation. I'm sure. Yes, no. Although this may be part of their normal upbringing and the way they behave in their own countries, in the UK this is often seen as very rude. Part of the ethos of treating patients with dignity is the idea of confidentiality. There is very clear and detailed legislation that has been enacted in the UK to protect patient confidentiality. Information pertaining to a patient's health should be only disclosed to the patient, unless the patient gives you very explicit written confirmation that the information can be shared with other parties, such as relatives or other clinicians. One has to take care that one keeps confidential information under lock and key at all times. The Royal College of Radiologists is a very important organization, and it has played an important part in my life as a radiologist. In your job plans within a department, you will have time set aside for continuing professional development, as they call it, CPD. You will be expected to undertake certain hours of self-directed learning and education, including audit and research, to improve your practice. The Royal College of Radiologists provides abundant material to support this, and each of their meetings has CPD points which are guaranteed. By attending these meetings, you will be able to access the CPD material and keep your learning up to date. As a radiologist, what I found most useful in my personal and professional practice is being open to both my colleagues and patients, to be clear in my communication, to listen to them and to approach them with politeness and courtesy. I would encourage all of you to do the same. It is important to integrate into the local department in radiology as well as outside radiology by interacting with clinicians and other colleagues. The NHS is a big resource. It has a lot of diversity that you can tap into to make your life, both professionally and personally, a big success. I wish you all the best.